morning, students. Today we will learn about white blood cell. We all know that blood is composed of the fluid portion, that is called plasma, and also the cellular portions. And among the three types of cell present in blood, white blood cell is one of them. And the difference among white blood cell, red blood cell, and platelet is that one of the major differences is that only white blood cell is a nucleated cell, whereas the red blood cell and platelets are non-nucleated. Now we will enter into our main chapter. So first comes the questions: how these white blood cell or leukocytes, as they are white in color, they are called leuko. Leuko means white. So how these leukocytes or white blood cells are generated? The process by which they are formed in a normal physiological process is called leukopoiesis. And this is a diagram or flowchart showing the various steps of leukopoiesis. Okay, we can actually divide the white blood cell on the basis of presence of granules in the cytoplasm or not into granulocyte or agranulocyte. And if granulocyte is present, we will call it granular white blood cell or granulocyte. They consist of neutrophil, basophil, and eosinophil, and those white blood cell that don't contain any type of granules in their cytoplasm are called lymphocyte. So lymphocyte and monocyte. So these are the steps through which the granular white blood cell or granulocytes are produced. This process is also called granulopoiesis. So as you can also see that the name of the phases and the corresponding picture are shown here. The first premature stage of this granulocytes is myeloblast. From myeloblast there will be ultimately myelocyte, okay, and then metamyelocyte, and then metamyelocyte will be ultimately converted into a granular cell. Either it may be neutrophil, or it may be eosinophil, or it may be basophil. So how can we differentiate among them on microscopically, as their microscopic structure? So as you can see that neutrophil and eosinophil and the basophil, they all are different in the color of their granules, and also the arrangement of the nucleus is also different. You can see the one common feature in all of them is presence of granules, and the color of granules is not same in all of them. In neutrophil it is bluish purple in color. In eosinophils there is large granule, and these granules are reddish in color. And in basophil they are also somehow bluish, but not uh, uh, entirely bluish, but there are some purple coloration also. This is basophil, this is eosinophil, this is neutrophil. And another difference is that the neutrophil nucleus is segmented. It contains 5 to 6 lobes: neutro, baso, and euso. These names came from the stain that they accept. Neutro means it comes from neutral. That means it doesn't give any color on staining. And in eosinophil means euso comes from acidic. That means it has a affinity for the acidic stain, and that's why it will appear as reddish in color. That is the color of acid. And the basophil comes from the name of basic. That means it has a affinity for the basic stain, and it will give a bluish purple granules in cytoplasm. That's why its name is basophil. Okay. And these are the steps of lymphopoiesis, that means the process of formation of lymphocyte, and this is the process of formation of monocyte. Okay, now we can show this process of lymphopoiesis or granulopoiesis in a flowchart. The first stage is pluripotent hematopoietic stem cell. So what does this pluripotent means? Pluripotent means that these cells have the capability to differentiate into any cells type that may be converted into RBC, or may converted into megakaryocyte or platelet, or they may also be converted into white blood cells. So that have innumerous scope. That's why this name has come, pluripotent. Pluri means plural, so they have the potency or ability to differentiate into any type of cell. Now they will form the colony forming unit in spleen, sorry, in spleen, and then from there they will ultimately convert it into committed stem cell. Committed means now they have differentiated or committed to differentiate into a specific cell type. Either they will convert it into RBC or WBC or platelet. From this stage they are committed to differentiate into one particular cell type. So this is the premature stage of WBC, that is called myeloblast. Blast mean immature cells. From this stage they will differentiate into two different categories. First one is promyelocyte and second one is monocyte. From the monocyte the macrophage will be produced, and from promyelocyte they can be differentiated into three types of granulocyte: neutrophil myelocyte, eosinophil myelocyte, and basophil myelocyte. From the neutrophil myelocyte, the next steps of neutrophil generation will be continued: young neutrophil metamyelocyte, then band neutrophil metamyelocyte, and polymorphonuclear neutrophil. And the same process will be also applicable for eosinophil and basophil. That is, they will be but ultimately converted to metamyelocyte stage, and from there they will be converted into their mature stage or polymorphonuclear state. Now I have already talked about the classification of WBC on the basis of having granules in the cytoplasm. They can be divided into neutrophil, granulocyte, and agranulocyte. The granulocytes are of three types: neutrophil, basophil, and eosinophil. And the granules of neutrophils are fine, reddish brown, uniformly distributed. Sorry, and nucleus is 3 to 6 looped, violet in color. So cytoplasm is pink and diameter 10 to 15 micron. So we will now compare this description with the picture that earlier I have shown. That you can see that nucleus is violet in color, it is 3 to 6 looped, and granules, actually these granules are not shown in these pictures, but these granules are actually reddish brown in color in neutrophil, but it will not accept any type of stain, so it will be remain neutral on staining. That's why it has gained its name neutrophil. Now the eosinophil, its granules are coarse, reddish, and large granules. Nucleus is bi-looped. Cytoplasm is pink or red in color, and diameter is 10 to 20 micron. Now we'll again compare this description with the diagram of the eosinophil. This is eosinophil. In the neutrophil, we couldn't have seen the granules because the neutrophil's granules are fine, uniformly distributed, and very small. So actually these granules cannot be shown in the picture. But in case of eosinophil, the granules are coarsely distributed. That means they are not uniformly distributed, and they are large in size, so it can be seen. And its nucleus is bi-looped nucleus, and reddish brown granules can be seen in cytoplasm. Now come for the basophil. Granules are purple blue in colors. Nucleus is also bi-looped here, and cytoplasm is purple blue color, and diameter is 8 to 10 micron. So this is the purple blue granules you can see in the basophil, and its nucleus is also bi-looped. Now comes to the agranulocyte. Agranulocyte, because they have no granules, that means absence of granules, that's why agranulocyte. And these are two types of agranulocyte. First one is lymphocyte, and second one is second one is monocyte. The lymphocytes granules are absent. Nucleus is large, occupying most of the cytoplasm. And in cytoplasm there is thin rim of bluish cytoplasm, because nucleus is so large, so it gives a very little space for the cytoplasm, so there will be a thin rim of bluish cytoplasm present in lymphocyte, and then the diameter is 10 to 14 micron in case of large lymphocyte, and if they are small then the diameter will be 7 to 10 micron. And in monocyte also, also a granulocyte, the granules are absent, and nucleus, it is a very specific or unique criteria of monocyte is that that nucleus of monocyte is large, kidney shaped and eccentric. Eccentric means in all of the cells we have seen that the nucleus is present in the center of the cell, but in this particular cell monocyte the nucleus is eccentric, okay, because it's kidney shaped, not round, that we have usually seen in other cell. And this cytoplasm is pale blue in color and diameter is 10 to 8 micron. Now we'll compare this description with the diagram or picture of the monocyte and lymphocyte. This is monocyte, this is lymphocyte, and this is monocyte. So you can see here that the nucleus of the monocyte is kidney shaped, in this present eccentrically in one side of the cell, and there is thin rim of pale bluish cytoplasm present here. And this is the picture of mature lymphocyte. You can see here that the nucleus is very large, centrally placed, and there is a thin rim of bluish cytoplasm surrounding the large nucleus. Now we will enter into the properties of WBC. Every cell have their own properties, and WBC also have their unique characteristics properties. The first property is that margination. Margination means normally WBC, as they are also a blood cell flowing through blood, they will normally flow through the blood, but whenever they have to move from one place or as the defense system of our body, their main function is to protect our body from the harmful environmental or other substances. So whenever they are needed into a particular place or a particular destination for their purpose to serve to protect our body from various harmful substances, the first thing they will go for, they marginate on the surface of the vessel, okay, and the next step is they will squeeze through the pores of this blood vessel. This property is called diaperesis. And this is a video, this will show this property. These are the red blood cell, red color, and also these are the WBC. Now WBC is attaching to the surface of the blood vessel. For this video actually they have used green color for better understanding, but actually WBC is white in color. This is a neutrophil. You can see that the nucleus is violet in color and is now squeezing through the pores of the blood vessel. This is called diaperesis. Now it has come out from the blood vessel. Now the third property is called amoeboid motion. Now they have to go to the particular place where they have to serve their functions to kill the harmful substances or destroy it. So to reach for that particular destination, they move through a particular motion that is called amoeboid motion, because it has somehow some similarities with the motion that we have seen in the amoeba. So that's why this motion has got its name of amoeboid motion. And this is the mechanism of that motion, that how does they actually can perform this amoeboid motion. They actually perform this amoeboid motion through formation of pseudopodium. Pseudopodium is nothing but extension of the cell membrane of WBC, and one portion of the cell will be linger forward, that will lead the cell to the particular place of destination. And the first thing that will happen is to attachment of the pseudopodium to surrounding tissue, so that it can become fixed in its leading portion, while the remainder of cell body is pulled forward toward the point of attachment, and that's how it will ultimately move towards its destination. And the importance of another thing is that for this particular motion, WBC will need energy. Okay, and this energy is provided by ATP. Okay, and by using this ATP through the action of actin and myosin, ultimately the WBC will move towards the destination through amoeboid motion. And we have given the importance of amoeboid motion also in this slide, that it helps leukocyte to migrate towards the site of infection and tissue injury. Otherwise, it will never become possible for WBC to reach to the site of injury. And there is another importance of this amoeboid motion, is that fibroblast moves towards the damaged area to repair it by this motion. Fibroblasts are basically skin germinal cell. So there is minute tear and shear in our skin always, all the time. We are not even aware of this. So for these injuries to be repaired, there is the movement of fibroblast is a must. And fibroblast, as it's also a WBC, moves through this motion towards the point of injury. And the skin germinal cell towards the scar area of skin, I have already mentioned this. Fibroblast and skin germinal cells points have been discussed. Now the fourth important thing is that especially important for embryo and fetus, that we know that organogenesis happens in within 3 months of the intrauterine life. Organogenesis happens, and in this organogenesis, the movement of the embryonic cells is a must. So these embryonic cells also moves through this amoeboid motion for development of special structure. This is a picture, video showing the amoeboid motion of WBC. Now WBC moving towards the destination. These are the bacteria or harmful substances. Now the fourth property, that is called chemotaxis. Chemotaxis means movement of WBC towards the source of chemical. Now what is this chemicals? These chemicals are actually toxin. Okay, this toxin can be either produced in our body, or they can enter into our body from outside source. On the basis of these, they can be considered either as exogenous chemotaxin or endogenous chemotaxin. Exogenous, like bacterial and viral toxin, they are not normal habitats of our body, so they will be considered as exogenous chemotaxin. And endogenous means degenerative products of inflamed tissue, various complement like C5a that are produced in our own body, so they will be considered in endogenous chemotaxin. In either of this case, none of them are normal components of our body. Our body's defense system, that means the WBC, are not familiar with them, so they will consider them as a foreign body, as a foreign structure, and any foreign structure is considered in our body as a harmful substance or enemy. So they will be keep moving towards this foreign body to destroy it, and this movement towards the source of chemical is called chemotaxis. Now the fifth and ultimate property is phagocytosis. It is not only a property but also the function of neutrophil and macrophage WBC. The process by which WBC, particularly the neutrophil and macrophage, engulf the foreign body and damage tissue is called phagocytosis, and it has some number of steps through which this process happens. The first step is recognition of the foreign body and then attach with this foreign body. And this recognition of foreign body can be many more enhanced by the process of opsonization. That means there are some substances like immunoglobulin G or mannose binding lectin or complement C3. These substances helps the WBC to identify the foreign body. Okay, this process is called opsonization, and the substance which helps in opsonization is called opsonin. Now after recognition of the foreign body or their enemy, WBC will be attached to them for the next step to happen, and the next step is to engulf this foreign body if they are small enough to be engulfed by the WBC. And then after digestion, then there will be digestion. After engulfment, the lysosome in WBC and the other cytoplasmic granules will release their digestive or hydrolase enzyme into these substances, so that will ultimately kill the substance by the process of digestion, or they will ultimately digest the substance. Killing. Now some substances are big enough that they cannot be entirely digested by the lysosome of WBC. So in that case, the neutrophil and macrophage will release some bactericidal agents, among which the superoxide or hydrogen peroxides are more important one, and they act as a bactericidal agents. That means the agents that can the actual ability to kill the bacteria, and by this process they will kill the bacteria.
In phagocytosis, phagocytes are attracted to the area of invasion by chemical products of the microorganism, phospholipids released by injured mammalian cells, or by components of the complement system. The phagocyte moves into the area of invasion and then attaches to the microorganism. The attachment is mediated by a variety of surface receptors, including antibody, lipopolysaccharide, and complement receptors. For example, the C3b component of complement coats bacteria or other particles,
which helps the WBC to recognize the foreign substance. This is the receptor for this opsonin to bind.
Is called opsonization.
This opsonin has now, through the process of opsonization, helps the WBC to engulf the whole body. Now the lysosome, which has engulfed the
releasing digestive enzymes such as lysozyme and proteases into the phagosome.
Foreign body is called phagosome. Now they are releasing their digestive enzyme in this phagolysosome. That means the lysosome that has contained the foreign body to be engulfed. This is called phagolysosome. And now they have released their digestive enzyme, and ultimately they have digested the whole substances. This is the process of phagocytosis. This is a diagram showing the various properties of WBC. This property of marginate themselves on the surface of the blood vessel is called margination. Then they squeeze through the vessel wall, and this property is called diapedesis. And then they move through the amoeboid motion by the formation of pseudopodium. This is called amoeboid motion towards the source of chemical substances, which is called chemotaxis, and ultimately after reaching in that substance they will kill or digest the substance by the process of phagocytosis. Now comes to the functions of WBC. Specific WBC has their specific functions. The functions of neutrophil is to basically phagocytose the harmful substances, especially the bacteria, and they collect at the site of infection by chemotactic property. They are actually the first line defense system of our body. Just like the border guard army of Bangladesh, if any time our country is attacked by the foreign army or the foreign enemy, then the first line defense system will be the border guard Bangladesh. So neutrophil can be considered as the border guard of our body. Now come to eosinophil. It has basically anti-allergic function, so they will collect at the site of allergy and limits the effects of mediators of antigen antibody reaction, and they also have the parasiticidal function because they have some parasiticidal larvicidal agents like major basic polypeptides, so they have the ability to kill parasite and the larva if they enter into our body. So any parasiticidal, the question if sometimes question may ask to you that which cell the cause of eosinophilia. Eosinophilia means when the count of eosinophil enhanced or increased above the upper limit of normal is called eosinophilia. So whenever the functions that are served by the eosinophil have to be served more, that means if there is any parasitic agent or larva into our body, or if there is any allergic reaction into our body, so eosinophil will have more functions to do. So in that case their count will be also increased. So if you can remember the functions of eosinophil easily, it will be also helpful for you to remember the causes of eosinophilia. That is applicable for every types of cell, either it's for neutrophil, basophil, eosinophil. If you can remember the functions of the particular cell, you can also understand the causes of the increased count of that particular cell. Now come to basophil. They contain heparin, that is an anticoagulant, natural anticoagulant, and slow reactive substance of anaphylaxis, which is responsible for various allergic reactions, and eosinophil chemotactic factors. So basophil is the cell which actually helps in allergy, and eosinophil is the cell which helps to reduce the allergy. So functions of these two cells are just opposite, and basophil doesn't only cause allergy, but they also attracts the eosinophil towards the source of allergy, so that eosinophil can come and remove these allergic agents or can subside the allergy by releasing eosinophil chemotactic factors. Okay, and another potent substance of allergy or any inflammatory reaction is histamine, bradykinin, serotonin, that are also released by basophil. So basophil is basically a cell which is responsible for any type of allergic reaction. So in a patient who is suffering from any types of allergy, both basophil count and eosinophil count will be increased. Okay, basophil count is increased because it is the basophil which is causing the allergy, and as a compensatory reaction in later stage eosinophil count will be also increased to subside the allergy. Now comes to the lymphocyte. Lymphocytes can be of two types. There is T lymphocyte and B lymphocyte. They will be discussed in detail in your microbiology, immunology. In physiology, we will just consider the functions of lymphocyte, basic functions of lymphocyte. The lymphocytes can be of two types, I have previously mentioned, T lymphocyte and B lymphocyte. And T lymphocyte is again of two types, that is called helper T cell and cytotoxic T cell. So from the name of this lymphocyte, we can somehow understand the functions of this particular lymphocyte. Helper T cell will help the functions of cytotoxic T cell. So what is this function? It will be discussed later. And also it helps in the functions of B cell, macrophage, and other antigen specific helper T cell. And cytotoxic T cell, it has the name of cytotoxic, so that means it will it is somehow related to toxicity. So for which whom it is toxic? So it is toxic for the harmful substances that can harm our body, like virus infected cell, tumor cell, okay, allograft cells that are not accepted by our body. So these cells are particularly destroyed by the cytotoxic T cell. And the B lymphocytes helps in production of antibodies that helps in humoral immunity of our body. And first they will convert into plasma cell, then they will convert into the antibodies. We know that there are two types of immunity in our body: cell mediated and humoral immunity. Cell mediated immunity is provided by cytotoxic and helper T cell. That means this immunity is provided by the cells, and humoral immunity means the immunity that is provided by antibodies. So B cell is a cell that is important for humoral immunity. Now come to the function of monocyte. Monocyte and macrophage are same. When actually they remain in blood, they are called monocyte, and when this particular monocyte come to the tissue where they have to perform their function, they will be considered as tissue macrophage. On the basis of the tissue on which they are performing their functions, monocyte can be named, has many names like fibroblast, Kupffer cell, hepatic Kupffer cell, etc., etc. And the function of monocyte is to phagocytose the harmful substance or phagocytosis, and they also has to present the antigen as antigen presenting cell, and they also helps to in production of cytokines like interleukin 1, 2 and tumor necrosis factor. These are the differential count of different WBC. These are very much important. You have to remember these very carefully. And these are the absolute count of WBC. The absolute count means actual count per microliter. And whenever you have asked the questions regarding the actual count or absolute count or differential count or any count, it's very important to mention the unit, in which unit you are answering the question. Now this is the total count of WBC in total, including granulocyte and monocyte. Now we'll go for the clinical physiology, in which condition the leukocyte count can be increased or in which condition leukocyte count can be decreased. We have already known that the upper limit of the normal count of WBC lymphocyte is 11,000 per microliter of blood. So if any case the count of WBC is increased above this upper limit, it will be considered as leukocytosis. So it may sometimes it can also increase in some physiological condition like in exercise, emotion, pregnancy, labor, because all of these things, though they are physical, but they are stressful condition, and in any stressful condition the count of WBC can increase because they serve as the defense mechanism of our body. So if they can identify any type of stressful condition, they will be alerted and their count will be increased. Now some pathological condition. The common formula to increase the cause of neutrophilia is that neutrophilia is the first line defense mechanism. So in acute infections or in acute type of inflammation, the neutrophil type count will be increased, like in acute pharyngitis, acute laryngitis, or trauma like surgery, burn, or myocardial infarction, or some inflammatory diseases like rheumatoid arthritis, gout, malignancy, myeloproliferative diseases. And eosinophil, I have already mentioned, as the functions of eosinophil is to subside the allergy. So in any type of allergic reaction like asthma, eczema, drug hypersensitivity, skin disease, the count of eosinophil will be increased. And also they have the parasiticidal function, so they will be also increased in any parasitic infection. Now come to basophil. Basophil count is increased in polycythemia, chronic myeloid leukemia, ulcerative colitis, iron deficiency, anemia, etc. And monocyte or macrophage is increased in any type of chronic inflammation or chronic infection. The purpose that was first initiated by neutrophil will be continued by macrophage. Okay, so it will be also increased in bacterial endocarditis, malaria, collagen vascular disease, malignant disease, because all of these diseases are chronic disease. Now the cause of lymphocytosis, any type of viral bacterial infection, lymphoproliferative disease, splenectomy will increase the count of lymphocytes. Now leukopenia. Leukocytosis means the increased number of WBC above the upper range of normal. Just like that, leukopenia means decreased count of WBC below the lower range of normal, that is below 4000 per cubic millimeter or microliter of blood. Neutropenia, when the count of neutrophil can decrease. It can decrease in typhoid fever, viral hepatitis, alcohol, bone marrow infiltration, autoimmune connective tissue disease, because all of these diseases have the ability to reduce our body's immunity system. So this has also ability to reduce the count of any type of WBC, including the neutrophil. Lymphopenia, how can the lymphocyte count can decrease? It can decrease in connective tissue diseases, lymphoma, renal failure, sarcoidosis, corticosteroid congenital. In this disease, they can be destroyed lymphocyte, so their count can also decrease. So that is all about today. Thank you very much. If you have any question regarding the lecture, you can comment on the video and you can directly ask me in the class. Thank you very much.